That's a soft tissue mass. The pink is bone metastases. And then there's these, the lung nodules. Basically what I'm doing is I'm designing a new kind of medical chart. The idea is that it's very visual as well as written text. It's based on the nutrition facts label that you have on food. I don't know if you remember back before we had that. I do. There was major controversy before the nutrition facts label. And now we assume it should be there. It's part of our culture. Everybody thinks they should be able to flip over a box of food and they should know exactly what is in their food. Well, I think we should have the same thing for medicine. I think you should know what is being done to your body, but also you should have the people who are working with you in a hospital know that too. Because the way it's set up right now, they don't. There's this attitude within medicine a lot of the times that the idea is doctor's in charge, and then it trickles down from doctor down to patient. Doctors know everything. Doctors know what's right. And don't question your doctor. They know what they're doing. You know, sometimes they don't. Like in the case of my husband's medical record, just from one hospital, I found over 20 errors in the medical record. I don't have a degree in medicine. So there's probably more. So my idea is let's take the nutrition facts label and let's make it this easy so that anybody who comes in contact with a patient, anybody who's providing care, would know what they need to know. So my major goals are, advocating for awareness, advocating for access to data, and patients being able to be part of that decision-making process. If you don't have access to your data, how are you going to ever know what's wrong? I mean, there's a real talk right now about computer technology in conjunction with health records, and how do we harness that? Up until this point, they weren't even talking about how the patient would harness it. They were talking about how the hospitals would. Like, how do you transfer data from doctor to doctor or hospital to hospital? How do nurses get this information from another nurse at a different hospital? And we weren't even part of the equation that was being talked about. When it's our medical data, it's about us, it's our life. We need to be part of this decision-making process. If we as patients become advocates, saying we need to be part of the solution, I think things are going to be much better. I mean, this is like a pivotal time right now. Congress is making these decisions about what's going to happen with your health care. You need to be involved in this decision.